Good morning, student. Uh, a previous session, we have seen the budget, research budget, how to prepare budget, and different angles of the research budget. And an example, the demonstration of the field budget. But now, we say there are categories of resources on the budget, and we mentioned the data collection. So we go to session 17. In which you're going to learn about data collection plan. By the end of this session, I'm expecting you to be able to describe typical problems that may arise during data collection and how they may be solved. You should be able to prepare a plan for data collection for develop the research proposal. You should be able to determine the various tasks of the staff needed for research. I should be able to prepare the work schedule or the Gantt chart. Also, you should be able to draw work schedule, which is the Gantt chart. Prepare the work schedule and draw work schedule, and which you call the Gantt chart. Let's see the typical problem that may arise during data collection and solution. Possible problems: source of data distortion that might include, and we say source of data distortion, which means the biasness. That may include the deviation from the sampling procedure set out in the proposal. Sometimes a researcher may deviate from the sampling procedure, which are actually set in the proposal, or doing something which suit the result which the researcher has expected them to. The second is variability of bias in observations or measurement made because a research assistant are placed under too much stress or inadequate supervision of the research assistant. This may bring variability or bias in observation or measurement made to a researcher. When you put too much stress to this researcher or research assistants or inadequate supervision of research assistants, we expect this to happen. Maybe another questionnaire not filled in, incompletely. You know, you get questionnaires which are not filled incompletely, or some information that are missing. This, or we call typical problem that may arise during data collection. You may do your data collection, but you may expect this problem with a common happening during the data collection. So, what should you do to resolve this problem, or to get the solution, or to prevent from these problems to appear? Let's see the solution. You know and you understand better, you should train research assistant. This assistant should be trained in which we call the capacity building. They should understand what really they are doing and the importance of what actually they are doing. And their mistake may lead to what they should be trained, what they are supposed to. Then pretest of the instrument. When I say pretest of the instrument, for example, you prepared a questionnaire, you have to test the questionnaire. First, the question asked from the questionnaire give what is expected. You have to test the validity of your tool or validation of the tool. You prepared it, does it work? This is what called pretest. You test your tools before using them to see which percentage of perfection does they bring to your research. So next is adequate supervision of data collection. But we say adequate supervision of data collection, you don't just let them go there and do the data collection because they go to training or you did the capacity building. Then you trust them that whatever they're going to do around, they'll bring the right thing as instructed to the training. But what you should actually do is to give adequate supervision. You must supervise, see what they're doing. So Next, you must revise method to check quality of data. That the method you're using for data collection, you must revise them to check the quality of the data and the information that you're getting from your tools. So let's go to prior anticipation of problem that might occur and prepare a plan to overcome them. A prior anticipation of problem that might occur and prepare a plan to overcome them. This is also a solution in which you may apply to not to get into this typical problem that may arise during data collection. So uh, we say these are solutions to prevent them from happening. Let's see preparation of plan for data collection for the developed research proposal. Preparation of a plan for data collection for the developed research proposal. A plan for data collection listing the tasks that have to be carried out and who should be involved. But we say listed tasks that have to be carried out and who should be involved, which means every task has a responsible person. And we say if a task against a responsible personnel, all the researchers and the research assistants who are there, they should have a task to do. Task A may be the responsible person is a researcher C, or task C maybe the responsible person is a secretary, or task D the responsible person a research assistant. We get that we say listed tasks that have to be carried out and who should be involved. That is what it means. So making rough estimate of the time needed for the different parts of the stand. You must estimate the time taken to each activity on your research. I get it. So you should make a rough estimate of the time needed for the different parts of the study. So identifying the most appropriate period in which to carry out the research. You must identify most appropriate period in which to carry out the research. But we say identifying the most appropriate period in which to carry out the research, it depends on the research design. Maybe if there are environmental factors needed, or season, or whatever, climatic condition, or what are we getting? So what we say identify the most appropriate period in which to carry out the research. It depends on the research design. I think this is clear to everyone. So scheduling the different activities that have to be carried out each week in the work plan. Everybody say scheduling the different activities that have to be carried out each week in our work plan, as we said, in our budget there, and the other that we should respect maybe these holidays, faith of your workers or assistants. Are we getting? So scheduling the different activities that have to be carried out each week in the work plan, as this is very important. So these are preparation of plan for data collection. So when you plan for data collection, this should be laid out. Shall listen should be recognized by a researcher to estimate the time, to know the task, know the responsible person, and schedule of the activities. I think this is well understood. Let's go to pre-testing. In pre-testing, as I said before, we say before the proposal development is finished, a pre-test of the data collection and the data analysis procedure should be made. When we say before the proposal development is finished, a pre-test of data collection and data analysis procedure should be made. What does it mean? We say that any tool, when you prepare tools for data collection, before you implement the tools in a research work, you should test them to get the credibility of your method. So the advantages of conducting a pre-test before the proposal is that we can draft the work plan and budget based on more realistic estimate, as well as revise the data collection tools before we submit the proposal for approval. Why should we do this pretest? Are we getting? So the advantage of conducting a pretest before the proposal is finished is that we can draft a work plan and budget based on more realistic estimates, as well as revise the data collection tools before we submit the proposal for approval. Because once the proposal is approved and there are mistake or errors on your tools for data collection, you'll have no chance or you may miss resources to correct the errors. So we get on the point. So, however, further pretesting and planning of the research have to be done in the field. However, further pretesting and planning of the research have to be done in the field. Let's see the stages in the data collection process. Stage 1, we have permission to proceed. Stage 2, data collection. And the stage 3 is data handling. Let's see the stage 1, permission to proceed. We said consent must be obtained from relevant authorities, individual and the community in which the project is to be carried out. We discussed this earlier, I think in our chapter 16 and chapter 15, lesson 16 and lesson 15. And we see this may involve organizing meetings at national or provincial level, at district and at village level. So for clinical studies, this may also involve obtaining written informed consent. When we say a written informed consent, I think we got the concept because we discussed it earlier. So the principal investigator will be responsible for obtaining permission to proceed at the various levels. The one who is obtaining permission to proceed at various levels called the principal investigator. So the Health Research Unit in the Ministry of Health or the institution organizing the course may assist in obtaining permission from the national level. So this is getting the permission to proceed, and we have seen the procedure for application and the procedure for ethical clearance. We have seen in session 15 and 16. So stage 2 is data collection. So during data collection, consider logistics. Who will collect what, when, and with what resources? This is very important when we come to logistics. Who will collect what, when, and with what resources? When we come to quality control, that must be reliable and valid. The quality control must control the quality of the data collected. And in this, we say when allocating tasks for data collection, it is recommended that first list type of data required. You should understand this. You must first list the type of data required. Also, you should identify who could best implement each of the tasks. Then, if it is clear earlier that your research team will not be able to carry out the entire study by itself, plan to look for research assistant to assist in relatively simple but time-consuming tasks. For example, in a study into the effect of improvement in delivery care on utilization of these activities, the following task division could be proposed. Example, logistic of data collection. That's in this figure 1. Example of logistics of data collection. For example, task record study. Where hospital plus health clinics. But who should carry out this task? That's why in the second tab you see task to be carried out by you say the research team with the research assistant. This will be the responsible personnel. Then second, focus group discussion with the health staff before and after individual staff interview. The responsible person or research team. Another task, individual staff interviews. Task will be carried out, the responsible person is research team too. Then shadowing MCH nurses. Of course, when we say MCH, And nurses, we know we are speaking of mother and child health nurses. And we know when shadowing mother and child health nurses, it's a responsibility person here is principal investigator. So interview with mothers are community based before and after delivery. Research team with research assistants. The task with the responsibility person. So this is logistic of data collection. Let's see step one, time for data collection. Think about how long will it take to collect data for each component of the stud. The time required to reach the stud areas, the time required locating the stud units, persons, group records, etc. etc. Search for specific informats, example, users or defaulters of specific services. It might take more time to locate informats than to interview them. The number of visits required per stud unit. Calculate the number of interviews that can be carried out per person per day. Calculate the number of days needed to carry out the interview. For example, you need to do 200 interviews. In this, we are going to see, for example, your search team or your research team of 5 people can do 5 times 4, 20 interview per day, which means every research team member will take 4 interviews per day. So we expect an interview to go for 20 interviews per day. And actually, we said your population is 200. So counting the number of days for interview. So you will need to tie this 200 divided by 20, in which you will take 10 days to finish up with your population. I think we are getting this concept. When we say calculate the time needed for other parts of the sun, for example, we said these 10 days. Now determine how much time you can devote to the study. Since the research team usually consists of very busy people, it is unlikely that team members can spend more than 30 working days on the entire study. So 5 days for preparation, including pre-testing and finalizing questionnaire, 20 days actual field work, 5 days data processing, and preliminary analysis. Here now we are getting the picture. What we say, this is our research proposal, and for how long will it take? Are we getting? Maybe 30 days, 60 days, It will depend on the research design and what actually is scheduled and the team that you have. So think of when should the data be collected, the type of data to be collected, and the demand of the project will determine the actual time needed for the data collection. Consider availability of research team members and research assistant. This matters a lot. The availability of research team members and research assistant. So the appropriate seasons to conduct the fieldwork. If the problem is season related or if data collection will be difficult during certain periods. Accessibility and availability of the sampled population. Then public holidays and vacation periods. You cannot force maybe the research team or research assistant to look into the days in which to them it's taboos, maybe the public holiday that I cannot work. You should consider them, maybe you do a research in December and 25th and 26th it's Christmas and Boxing Day. You cannot force them to go to. Or if it is Sunday or Saturday, some people respect Sunday, some people respect Saturday, they cannot work. So when you're calculating the time, you should consider these days as we discussed earlier. Stage 3, data handling. In this data handling, we say develop a clear procedure for handling and storing data. You must develop a clear procedure for handling and storing data. Number of questionnaires and other research tools. Decide if this should be done at the time of the interview or at the time the questionnaire is stored. Each tool used will get its own numbers starting from 1. Each tool used will get its own number starting from 1. If some data set are linked, example, you interview leprous patients as well as their relatives and neighbors to analyze the interaction and the possible stigma from different perspectives. Better link the numbers. For example, if you have interviewed a patient P9, his neighbor will be N9. Then we get it. Because even this neighbor, whatever the stigma that you want to find, what it will rate to this case P9. So, and the neighbor also is related to P9 patient and the code. So, you come to neighbor 9. Maybe, and his wife or son, daughter will be R9. I think we are getting the picture. These are relatives and this is neighbor. And they're linking to a leprous patient. So, identify the person responsible for storing data and the place where it will be stored. Decide how data should be stored. Record forms should be kept in the sequence in which they have been numbered. In what sequence should data be collected? The record forms should be kept in the sequence in which they have been numbered. In what sequence should data be collected? In general, it is advisable to start with the analysis of data that is already available. This is essential if sample of the respondents is to be selected from the records. Another rule of thumb is that qualitative research techniques such as key informative interviews, focus group discussion, that are devised to focus the content of questionnaires for interviewing a larger group of informant should be carried out before finalization of these questionnaires. Focus group discussion designed to provide feedback on issues raised in larger survey should logically be conducted after a preliminary analysis of the questionnaires. To use time and transport efficiently, data to be drawn from different sources, but in one locality should be collected at the same time. For example, interviews with health staff in health center, observation of equipment available in the health center, and the interview with mothers living around the health center should be scheduled together. For example, interview with the health staff in the health center, observations of equipment available in the health center, and interviews with mothers living around the health center should be scheduled together. Note, it is always advisable to slightly overestimate the period needed for data collection to allow for unforeseen delays. It is extremely important that the data collected are of good quality, reliable, and valid. Otherwise, we'll come up with false or misleading conclusions. Possible sources of data distortion bias that should try to prevent include deviation from sampling procedure set out in the proposal, variability of bias in observation or measurement made because subject changes his behavior as a consequence of the research. For example, a subject may act more positively while being observed. Blood pressure and pulse may increase when the subject is anxious. Use an standardized weighing scale or inaccurate or no guidelines for interviewing. Variation in researchers' observations, observer variability, in what they observe or measure. For example, researchers may be selective in their observations, observer bias, measure, question, or note down answers with varying accuracy, or follow different approaches, one being more open, friendly, probing than the other. variation in criteria for measurement, or for categorizing answers because we change them during the study. Our measures ensure good quality of data, prepare a fieldwork manual for the research team as a whole, including guidelines on sampling procedure and what to do if respondents are not available or to cooperate. So, a clear explanation of the purpose and procedure of the study, which should be used to introduce each interview, instruction sheets on how to ask certain questions and how to record. Uh, Lastly, determination of various tasks of the staff needed for research. We say when allocating tasks for data collection, it is recommended that you first list them. Then you may identify who could test, implement each of the tasks. For example, this is an example. It doesn't differ much from the logistic that we've seen before. In this, for example, it's very same. A record start hospital and health centers. So we take a research team with a research assistant, a focus group discussion with us staff before and a individual staff interview. A research team are responsible. Individual staff interviews. A research team shadowing mother and child health nurses. We know it's principal investigator, as we said before, and the interview with the mothers or community based before and after delivery. We expect the research team with the research assistant to be responsible. Let's see preparation of a work schedule. And this work schedule is what we call a Gantt chart. It is also called a Gantt chart. So let's see how to develop a Gantt chart or a work schedule. In developing a work schedule or a Gantt chart, we must review and revise, if necessary, the list of tasks you prepared for your plan for data collection. First, if you want to develop the work schedule, you cannot develop the schedule if you don't know uh, the task that should be done. So the first you have to review and revise, if necessary, the list of tasks you prepared for your plan for data collection. Add to the list the other tasks you must complete not related to data collection. To the list, you're going to add the list the other tasks you must complete not related to data collection, such as clearance of proposal, data analysis, report writing, feedback to authorities, and the targeting group. You get it? It's not only the task to data collection. So all tasks that requires you to finish the ongoing research must be listed there. So you number all tasks, then make a revision if required, then you start preparing a work schedule or a Gantt chart. Step 1, consider the time required to reach the study areas. The time required to locate the study units, person, group, and records, as I said before. So if you have to search for specific informats, example users, defaulters, or specific services, it may take more time to locate the informats than to interview them, as we have seen earlier. So the number of visits required per study unit for some studies, it may be necessary to visit informats a number of times. For example, follow-up pregnant mothers or malnourished children. Time needed for follow-up of non-respondents should also be considered. Step 2, you must calculate the number of interviews that can be carried out per person per day. Example, we have seen there that one person may carry maybe 4 interview, and you see how many assistants do you have. If you have 5, then it will be, you take 20 interview per day. If they are 10, you take 40 interview per day. So step 3, calculate the number of days needed to carry out the interview. So it will depend to the start design and the population. The bigger the population, the more the days. Or if the many the research assistant, the fewer the days. So you'll calculate the number of days needed to carry out the interview. For example, you need to do 200 interviews. Your research team of 5 people, each can do 4 interviews per day. So you need how many days for the interview? Come into calculation. Step 4, calculate the time needed for other parts of the study. For example, 10 days. Here you came when you need how many days for the interview you get. Then step 4, you calculate the time needed for other parts of the study. For example, maybe 10 days. Step 5, determine how much time you can devote to the study. It is unlikely that team members can spend more than 30 working days on the entire study. So, 5 days for preparation, including pre-testing and finalizing questionnaires, 20 days actual field work, and 5 day data processing and preliminary analysis. So I got the 3 days, almost everything is done. So now you come to drawing a work schedule or Gantt chart. A Gantt chart is a chart that shows all of the different subtasks of project and how they relate to each other in terms of time. It's a way of displaying project schedule and it helps get the work done on time. It shows all the tasks that needed to be done, the amount of time each task is expected to take, the time frame in which individual tasks are to be completed, and the relationship between various tasks. This way, everything gets done on schedule, and you'll never waste time waiting for a task to be completed that should have been done already. So, the Gantt chart should indicate the task to be performed, who is responsible for the task, the time which task is expected to take, the length of which task is shown by a bar that extend over the number of days, weeks or months the task is expected to take. Uh, Students, I think if you understand the concept, it's very simple to draw this Gantt chart, and let me make it as an assignment. Uh, uh, Putting it as an assignment, I'll write a question for you. Actually, let me do that. Uh, in which to lead you as a researcher should be taken out. I get it. Then from there you try to design something and present a Gantt chart. I think with this little concept, try down to draw the work schedule or the Gantt chart and whatsoever according to your understanding. It doesn't need even to give out the question, according to the concept in our what? In our lesson. Please draw a work schedule or a Gantt chart and let me see. By next week, please make sure you submit them because I can see most of my assignment are there and people are not collecting. Few of you have sent the assignment to my email address, but some they take it simple. So it should not be that way. Let's see the key point. Uh, we say problem that may arise during data collection are sources of data distortion bias. And we said the Gantt chart is planning tool which depicts graphically the order in which various tasks must be completed and the duration of each activity. When allocating tasks for data collection, it is recommended that you first list them when you may identify who could best implement each of the tasks. Evaluation, these are some few questions in which you'll ask yourself and you may get something out of it. When we say what are the tasks for research staff, what are the typical problems that may arise during data collection, or what steps are in preparing a work schedule or Gantt chart. Actually, answer this last question and then try to demonstrate what a Gantt chart is. Thank you. Thank you for your time, and God bless you. Hope you understand the subject. We're going to meet into our platform for questions. Thank you.